Hey everybody, welcome to another episode where I break down a scene from The Pitt. It's episode 7 this time. I'm going to try and do a more full review this time, but probably not the whole episode, but a few key scenes. Maybe next time I'll do a full episode review. But for now, let's dive in to The Pitt.
Terrence, I'm Dr. Langdon. Do you go by Terrence or Terry?
Terrence,
So, what brings you in today?
I averted my ankle playing table tennis.
Averted.
Yes.
You mind if I take a look?
Are you an orthopedic surgeon?
No, I am an emergency medicine specialist.
Could I talk to an orthopedic surgeon? I'd prefer an expert in that area.
Okay, cool. Right off to a good start here. Looks like Dr. Langdon's seeing a patient with an injury, an ankle injury of some sort. And if you can notice, the patient seems a bit agitated. He looks hyperexcitable. I'm going to say he's on the autistic spectrum, if I'm allowed to make that spot diagnosis. And it's very interesting because it means you're going to have to change your whole dynamic of history taking and trying to get to the root of the problem and also to initiate treatment as well. So let's see how Dr. Langdon manages this.
Well, I'm pretty good at ankle sprains.
How do you know it's a sprain?
Well, I'd have to examine you first, but
Could it be a Jones fracture or a dancer's fracture?
could be. Again, I'd have to look.
Fair enough. He's asking the right questions. Both of them are asking the right questions. How do you know it's a sprain? Without examining, without taking history, without doing any sort of investigations like an x-ray. So reasonable question. How do you know? Now let's see Dr. Langdon handle this.
Why don't I examine you, and that'll tell me...
Shouldn't you take a complete history on the present illness first?
Sounds like you're more interested in asking the questions, so...
Sorry, Dr. Langdon. Actually, he's right. You should take a history. And it doesn't take that long to take a history. In every patient that I see, especially in the ER, because I'm called down to the ER to see critically ill patients, and I will take a history no matter what the diagnosis is that's been given to me by the parent team, by the ER guys. I will start from the very beginning. You're going to have to do the full history examination, even, abbreviated, before you come up with your own plan. So even if I'll go through the findings of the ER guys, the ER team, but I'll do my own history taking. I'll do my own examination, just to make sure. And it is expected of every doctor to do that. So yeah, you're right. You should take a full history and exam, please.
You didn't ask if I felt the pop or a snap. You didn't ask about previous injuries. You didn't ask about weight bearing.
Why don't I get you some fresh ice?
Ooh, Dr. Langdon giving up early.
Hey, pussycat.
My name is Whitaker.
Pussycat, I need to use the bathroom. Can you get a key for this?
I don't think I should.
Don't be a pussy, pussycat.
Yeah, don't be a pussy, pussycat. Oh, you gotta love these old ladies. And a little secret about older ladies, older patients. Some of them can be very, very vulgar at times. The older they get, I don't know, but you get some characters. Of course, it's creepy and it's borderline harassment on this young doctor here, but can be amusing. But of course, if it was an old guy, it'd probably be even more creepier. But you will find lots of more senior citizens, ladies, who would be yucky, especially if they're inebriated. I don't know about Myrna's story here, but I'm sure she's got an interesting one, especially with the handcuffs and everything. Let's see how Whitaker handles that. Or he's going to get some support from his nurse lead.
You need a bedpan, Myrna? Yeah. Lassie.
Ooh, dodged a bullet there.
Good sandwich. Yeah, really good, actually. Yeah, I can tell from all the crumbs you're getting on my workstation. We eat in the lounge.
Come on.
Lunch and all. I'm so sorry. I was going to grab a patient. Maybe wash your hands first.
Yeah.
Oh, that's a bit mean. The attending there is being a bit of a dick. I would never do that to the junior residents. Yeah, sure, just tell them, yeah, please don't spill crumbs on my workstation. But I wouldn't be passive aggressive like that. It's just being a dick.
Is everything okay, Dr. Langdon?
Oh, yeah. We got Dr. Google in Central 9 bombarding me with questions like my 4-year-old.
Dr. Google, interesting. So people nowadays have access to so much information. It's a bit overwhelming. There's too much information, to be fair. That can be quite frustrating at times for us as physicians, because our patients come in with preconceived notions. Sometimes they're correct, and sometimes it's useful. They know about what's going on, but sometimes it can be quite frustrating as well with preconceived notions, and sometimes like this guy, Dr. Google. But he's asking the right questions, really. But Dr. Langdon just wants to get it done and dusted. It doesn't look like it's a critical case for the ER room, really. And he just wants to get it sorted out quickly. And Dr. Google is not making life any easier. Well, let's see what Dr. Langdon's got up his sleeve, because I think he's digging up his records in there.
I couldn't even get through a history.
Is that his chart?
Yep.
Can I see it?
Knock yourself out.
And regarding Mel, Dr. King, I got a feeling she's on the spectrum as well. I'm just observing her from the previous few episodes. I might be mistaken. She might be neurodivergent or something like that. But she's definitely on the spectrum on one end. It looks like she's taking over, I think. Let's see.
Oh, he's autistic. Did you see that in his past medical history?
It's an ankle sprain. It has nothing to do with the injury.
No. Your past history has everything to do with your presenting complaint. That is very, very bad doctoring. Everything in your history is important. It might not be important now, but it could be important later. And in this situation, it is important. We know he's autistic, so you're going to have to approach him differently. You want to get that ankle sprain sorted out. Don't focus on the injury. You got to focus on the whole individual. It's called holistic medicine. It's what we're supposed to practice. Your patient is not a list of problems. Your patient is a patient. It's a person. It's a human being. So talking about his past history, his social history, everything has something to do with him. And yeah, it's just an ankle sprain. Yeah, it's just an ankle sprain. But we don't know what it means to him. An ankle sprain, it means, he's immobile. He won't be able to carry out his day-to-day activities. We don't know how it's going to affect that patient. And it's interesting. You should have a certain level of empathy. I know when you're in the ER, it's a busy place. You get hundreds of people streaming in and out. And you want to just keep on top of things, but in the end, it's human beings just like us, and they all got problems. They all got. They're not here because they got nothing else to do on a sunny day. So you gotta have to try and put yourself in their shoes. Not only is it just being a decent human being, but it will help you get to the root of your clinical problem as well. So let's see. I think Dr. King is going to approach this probably in a different manner, so to speak.
I could talk to him.
Great. I can see 3 other patients while you do.
Probably can. Okay, Dr. King, have at it.
Dr. King?
Hello.
Dr. Langdon is with another patient right now, so I'm going to finish taking your history. Is that okay?
Sure.
Okay. It's a little bright in here. Oh, that's...
Oh, nice touch. Nice touch. So do you see what she's doing there? She is reducing the amount of overall stimulation that's in the room and the environment, which is very important for a patient like this. You don't want them overstimulated. So she's closing the door, shutting out the noise, making sure there's nothing beeping going off, no alarms, pulling the curtain so it's less bright. Hospital lights are awfully bright. And they're in your face most of the time because it's you get the spotlights, theater lights. So she's turning all that down, making it a more comfortable environment. for the patient. She's obviously handled this sort of situation before. I don't know it's because if she's possibly on the spectrum itself, or maybe she's probably seen patients like that. I believe she was in the VA before, but I don't know you find patients like that in the VA. Let's see.
Sorry, the ER can be very noisy.
Yes, it can.
So I heard that you might have sprained your ankle playing table tennis?
I averted it.
Yeah?
That's good. Might have sprained. It's not like, oh, you sprained your ankle. She's using more ambiguous language, which is helpful in this situation.
What is your biggest concern today, Terrence? What worries you the most about your
Very
pain
good.
in your ankle?
What worries me? Do you mean right now in this moment?
Right.
She's asking the right questions. So it's not like, where's the pain? What happened? It's like, what worries you as a person because of this?
Yeah.
I'm worried I won't be able to play table tennis if it's a bad injury. There's a tournament in 6 weeks and I already registered. It's my first tournament.
Wow, that's a big deal.
Yes. The championship is hosted by the South Park Table Tennis Club. 9 players have USATT ratings over 2,000. 1,400 is considered average. 2,000 is a master player. My goal is to get a rating over 2,000.
Well, let's get you to that tournament then.
That's very good. So she's establishing a sort of common ground there, or showing that she has an interest in his situation beyond his injury. His ankle might not be that important. His ankle injury might not be that important, but the fact that it's stopping him from attending this tournament and table tennis obviously means a lot to him. She's creating a better relationship than the one that Dr. Langdon had earlier, and this will help her to elicit the history, to carry out the examination, to get a plan in place for his ankle, and make sure that the patient himself feels comfortable and that he's involved and that somebody is actually looking into his overall sort of well-being and not just focusing on the injury itself, but also the sort of the implications of that injury, which is this gentleman missing his table tennis tournament, which obviously is very, very important to him. Okay, let's keep watching. Oh, surprise, surprise. Look who's back.
Terrence, would you walk around the room for me, please? I'll be able to tell a lot more about your injury.
Yeah, very simple. Instead of doing an exam, you could just get the guy to walk around. Well, we will tell you a lot about your injury.
How painful? On a scale from 1 to 10, 10's the worst.
The worst?
Generic questions.
Or the worst that a human being can experience.
A little pain is a great answer, Terrence. Thank you.
Yeah.
Well, based on your walking around, I don't think it's a serious injury. You know what? There's actually something I want to show you. I'll be right back. Sometimes this tendon called peroneus brevis can pull off a piece of this bone, the fifth metatarsal.
That's the dancer's fracture, right?
Exactly. You most likely have a second-degree ankle sprain. The X-ray will tell us everything. Tech will come get you, and then I'll come back and show you the images.
Great.
Okay.
Oh, very good. She's taken the time to get a model. I don't think I'll be able to go that far, but it's very nice that she could do that. In an ideal situation, you probably wouldn't have the time to bring out a model. I don't even think we keep those around. But kudos to her. Hey everybody, thanks for watching. We'll be coming out with part 2 of this episode shortly, most probably in the next couple of days. If you don't want to miss the next breakdown of the next scene in episode 7, make sure to subscribe, give a like if you like it, and I'd love to know what your comments are, so please leave a comment as well. So we'll see you very, very soon.